Thanks for joining us to talk about the wonderful, wonderful work happening in Kane County. We are going to start with some introductions. I will kick us off and then just pass it so we can have a seamless kind of intro. My name is Asamia. I use she, her pronouns, and I work with the bridging team at Human Impact Partners. And Sarah, I'm going to pass it to you to introduce yourself. Sarah?
I'm sorry, you said Sarah or
Yep.
Salma? Okay.
Sarah, sorry.
Okay, I'm so sorry. Hi, everyone. My name is Sarah Gonzalez, and my pronouns are she, hers, and I'm a coffee organizer. I'm a senior organizer in Illinois. I have been with the organization for 10 years, and yeah, so I'm here with parent leaders and my partners from the Kane County Health Department. So I'm going to pass it to Maria.
Hi, everyone. I'm Maria. I'm the program manager for the Children's Mental Health Grant at the Kane County Health Department. And I've been with the health department a little bit over 2 years now. And I think I've been working with the parents for a little bit over 2 years now. And together, we have the initiatives of the Parent Council, which is meant to lift parent voices with education, outreach, and advocacy. And then we also have the Parent Cafe Support Network, which is peer-to-peer support through sharing, leadership, and connection. And we also have a couple other projects coming up with them as well. And with that, I can go ahead and pass it to Emily.
Emily, before you go, just a reminder for us to pace ourselves.
Hi, everyone. My name is Emily Cole, and I'm an organizer with COFI. I am an organizer on our statewide mental health healing and mental health justice and equity campaign. And I have been with COFI for 4.5 years now, supporting parents in Kane County and statewide. And I will pass it to Sylvia.
Hola, buenos días. Mi nombre es Silvia Martínez. Uso ella como pronombre. Yo soy madre líder ya con COFI por 9 años. Soy también parte del Concilio de Padres del Condado de Kane. Y pues somos un grupo activo en el área de Elgin y Aurora. Estamos trabajando con la comunidad ya desde hace 5 años. Hemos tenido muchos éxitos y estamos con planes de seguir avanzando con nuestros éxitos para seguir apoyando a la comunidad. Gracias. Se lo paso a Liliana.
Thank you, Sylvia. Hello, everyone. My name is Liliana Olayo, and I'm a parent leader working with COFI. Being trained by COFI for about almost 10 years, and I'm also a peer trainer providing training to other parents. And my pronouns are she, hers. And I'm also with the Kane County Health Department Implementation Systems of Care team. So thank you. And I don't know, I can pass it to Julian.
Thank you, Liliana. My name is Julian. I use he or they pronouns. I'm with Human Impact Partners, and at HIP, I'm the Bridging Program Director. Very excited to be here with you all today and hear you tell your powerful story of your work together. Passing it back to you, Asamia.
Thank you. Thank you all for introducing yourselves. We're going to get started with some background and context. And so most people watching or listening don't know about your community in Kane County or your work around mental health and parent organizing. I'm going to kick it to Emily and Maria to get us started. Can y'all describe the big picture of the issues you've been dealing with, how your work together started, and what you're trying to achieve?
Yeah, I can jump. I'll kick us off. So Kane County is a community about an hour west of Chicago. And COFI has started organizing with parents in Kane County about 10 years ago. Liliana was one of the first parents to be trained as a COFI parent leader, and has really blossomed in both Aurora and Elgin into a really strong basis of parent organizing for our organization and really pushing things forward as a state level. And so parents have really been taking the lead in organizing for a number of issues. And starting in 2019, 2020, mental health really came out as one of the really big issues that parents wanted to focus on, even before the pandemic, but the pandemic really underlined the importance of focusing on mental health. And so that was something that parents really took the lead on. But recognizing that we can't do it alone. In COFI, we use what we call the web of support, and recognizing who is around us and who is able to support our goals. And so within our web of support, we're folks within the Kane County Health Department who are going to be able to help us reach the systems and policy goals that we had in order to really create a shift for a better mental health system for all families, including families that are undocumented.
And I'll add to that yes, this all started years ago when, when the pandemic happened and parents conducted different surveys in the community, and they really found that, wait lists for services for services that were, by bilingual or Spanish speaking therapists were very, very long. So then along with the Kane County Health Department, they had the idea of kind of forming this Parent Cafe support network to try to kind of bridge that gap in supports for the community. Again, not to replace, the work of a therapist or, professional help, but really try to bring the community together again through that peer-to-peer support. And also the parent council was formed to really get that parent voice out to the community and also behavioral health organizations and help them better understand what's going on with families and in the community.
Thank you for that context. I think now before we pivot, can we just hear just a little bit more about how the Parent Power Centers came out of that need? Maria, you talked about the need for peer-to-peer support, and I believe the Parent Power Centers were a hub for that work to take place. So if we could just speak a little bit to that before we move on.
Yeah, and so the Parent Power Center is actually something that's a little bit newer, and it's actually something that was put together by COFI. I know that they got money from State Representative Karina Villa and also Barbara Hernandez to kind of bring those peer-to-peer support groups together in one location, and that is the Aurora location. And I think, that's something that we also want to replicate. So along with the parents, help with the parents and also, taking, bits and pieces, we wrote for a family-run organization grant. And with that family-run organization grant that we've received, and that's starting in January, we want to try to replicate a Parent Power Center in Elgin, because we know it's, very needed in both sides of the county, and, Kane County is very big. So driving from Elgin to Aurora could mean an hour to, try to access some of these peer-to-peer support groups that are happening. Yeah.
Thank you.
If I could just add a little bit to Maria, she really summarized everything very quick, but it's been more. When we were collaborating with the Kane County Health Department in the Parent Council, the parents were trained by different models like parent cafes with under the model of Be Strong Families, and also restorative justice. And from that, the parents, we start doing the peer-to-peer support, small groups at different public locations, like the Elgin Public Library, the Aurora Public Library. And the community start noticing the work that parents were doing. It wasn't like being seen before. And from that, we did some community forums where we're giving, a little bit of models, how we were doing it. And the community was invited to those forums, and Senator Villa was in one of those, and she actually got to see us in action, the parents doing it. And suddenly she came out to the office people, the administrators, and she asked, like, she wanted to meet with us and know more about what she saw, about what the parents were doing. And from there, she asked us, like, what do you need to do more of what you already doing in the community? So the first thing, was like money. If we have more money, we could do more of those, through the city, but lack of money, because at that point, the health department, they pay for the training, because the training wasn't free to the parents. To the parents was free, but was paid by the Kane County Health Department. So everything, it have a cost. Like, other than that, the parents would never have the opportunity to pay for those trainings from our pockets, So that was the first investment that the Kane County Health Department did, and they see the value in investing in the parents. That was an important piece that Maria skipped, because they saw what we were already doing, but we were doing it because the health department invest on those trainings.
Thank you, Liliana. You kind of just began speaking to inside-outside strategy, so appreciate you for adding that. But we're just gonna zoom out and offer some context. First, we know it can be challenging to have productive collaborations between government agencies like health departments and community power building organizations, which are a part of social justice movements that often approach government as the target of their community organizing. When we talk about inside-outside strategy as the intentional alignment and coordination between people inside of government and community power building organizations on the outside, working together in partnership to achieve a common aim, kind of like what you all just touched on. It involves each side using their relative power, voice, and resources to create the policy and systems changes called for by the community. It can take a lot of different forms in different places and can change over time. Now let's dive in. This first question, we're going to kick it to our COFI team, Sarah, Sylvia, and Liliana. And we're going to talk about leadership, which is an overused word that can mean a lot of different things. What has it meant to you all? What roles or positions have you been in to leverage and shift power? And also, have you had support from people in other positions of power?
I'm gonna let
Okay.
Sylvia and Liliana to share about their own experience as parent leaders.
Muy bien, puedo comenzar yo. Sí, mi experiencia como líder, madre líder en la comunidad ha sido muy buena. Creo que he tenido muchos éxitos, muchos logros. Me ha servido mucho en mi experiencia como madre, como colaboradora en la comunidad. He aprendido mucho. Tengo desde el 8 años ya con COFI. Mi primer entrenamiento que yo recibí fue Yo, mi familia y el equipo. Es un entrenamiento donde me enseñan y me dan las herramientas para crecer como líder yo. para cuidarme yo, para cuidar a mi familia y después salir a cuidar a la comunidad. Después de ahí viene otra serie de entrenamientos y pues bueno, hablando donde mi liderazgo hizo boom, donde crecí y llegué más a la comunidad fue en tiempo de pandemia, cuando tuve la oportunidad de certificarme para hacer café para padres. Fue una gran experiencia que gracias a la colaboración que tuvo COFI con el Departamento de Salud en el condado de Kane, como lo dijo Liliana, nos apoyaron a los padres, creyeron en los padres para que nosotros nos pudiéramos certificar y salir a la comunidad a ofrecer diferentes círculos de sanación, café para padres, y otras cosas que ya se están haciendo también en la comunidad, viendo la necesidad de los padres y de la comunidad. Entonces, es ahí donde yo he ido creciendo día a día. La comunidad me ha hecho crecer también por esa demanda que los padres me dan a mí cuando vienen a los cafés para padres, que necesitan más ayuda. Entonces, yo como madre líder siempre estoy buscando cómo seguir capacitándome para seguir ayudando a la comunidad. Estamos viviendo tiempos difíciles, entonces necesitamos más apoyo y seguir creciendo, porque no me puedo quedar solamente con lo que ya recibí hace 5 años, necesito más para poder mantenerme física y emocionalmente bien yo y poder ayudar a la comunidad también. Si quiere Liliana agregar algo más, adelante.
Yes, and I really believe in the model of organizing, especially of the coffee model. I really believe that because I'm proof of that. When I, like Sylvia, when I started my training for the first time in back 10, almost 10 years ago, I wasn't not even close to what you see now. I was just a very shy parent, like being afraid to ask for help because, I was always being told, like, especially when you are an immigrant, you don't deserve or you don't have rights or they're not gonna pay attention to you. So with that fear or be hurt and come to ask for services, that was the idea of, okay, the less I talk, the less I bother people, the better. Then after I started organizing, and realizing that the power that a parent has when they are advocating for their children, and not only as an individual, but when you're advocating for all children, and when you come with more parents, you are super strong. And that I saw the model of the organizing and doing goals and achieving the goals. I start, kind of like just, let me see if this works. Being a parent, it was usually only like 8 parents come to the meetings with the principals or at schools. So the idea of like inviting more parents and be heard where they needed to be, our voices be heard when we were looking for support for our children's side schools. That's when, for me, everything started to bring the model of organizing in a smaller scale, inside the schools, and be able to outgrow those 8 parents that we were attending meetings, about 200 parents. So, it's when like I became the president of the Bilingual Parents Advisory Committee and inviting more parents. I use the model of organizing with other parents and use representatives from each school and inviting more parents through those 2 parents because I couldn't be in all the buildings. And that's when I see the results. Is like, you see, this really works. We are very powerful when we organize, but when you are doing things, on your own, you cannot get this kind of results. So I start being trained now to be a peer trainer with the coffee model. And that became, like my super passion, like changing the mind of parents, like I was with my, very close-minded, and start reaching more parents into their leadership, like when you realize the power that is within you, within your voices, you can support other families and you can replicate so many. And now we are not only just their parents, but we are become the super parents because we realize that we live in the community, and we are not only living in the community, but we are the community. And that's when we start targeting, more parents, and we start talking. Parents, we talk a lot, but sometimes not in a very good platform. And it's like, okay, let's keep talking, but now bring it to this other level where our voices need to be heard and the change will be happening. We either complain between us parents because things are not happening, but things are not gonna be happening or not gonna be changing if we keep just complaining between, here at our kitchen table. Okay, let's make that kitchen table the legislators table and being more advocating for each other. And that's how, it's like, if you don't know, let me find out who can know. And then we become a bigger network, because now we have allies. We have the health department, and if I don't know something, I reach out to Maria, I reach out to Emily or Sarah, and they're our big web of support for me and for most of the parents leaders that we are. We know we're not alone, and we have a bigger team, on our back, and we have a lot of big responsibility to keep advocating for more families and for more parents. We have seen the change, but it's like it's not enough. We need to keep doing, and we need to keep organizing.
Thank you, Liliana. Sylvia, you want to add anything else?
Sí, quería agregar también, como comentó ahorita Liliana, mi inicio fue cuando nos empezábamos a reunir de 4 a 5 personas. Ahí fue donde yo conocí a Sara. Después creo que a Sara se le descontroló todo porque era tanta gente que no podía, en Aurora, Elgin, en todas partes era tan solicitada. Ahora somos un grupo tan grande y lo que me gusta mucho es como yo he aprendido a liderar a otras familias con mi ejemplo yendo a Springfield a abogar. Cuando me llevo a mi familia, eso me hace sentir muy bien. Siento que estoy enseñando, involucrando a mis hijos, a que ellos también tienen el derecho de abogar. Y abogar no solamente por mí, sino por otros. Esas personas que no pueden ir porque tienen que trabajar y no pueden dejar de trabajar para ir a abogar por una salud para todos, salud gratis para todos, o para esas madres que tienen niños pequeños y no pueden ir a abogar porque tienen que quedarse a cuidar sus niños. Entonces todo eso me hace sentir muy bien y estamos invitando a la comunidad que vengan, y me llena mucho de emoción ver que salen camiones y camiones, un grupo de personas, de más de 300 personas, de solamente COFI, abogando por nuestras comunidades. Eso me hace sentir muy contenta de haber llegado a COFI, de tener esas conexiones con el Departamento de Salud y otras organizaciones que también al vernos quieren seguir el modelo que estamos usando en COFI.
Wow, thank you both for sharing your stories. I'm feeling so inspired. And I just want to name that, as someone who used to organize parents, having 8 parents at a meeting would have been amazing. And y'all were able to get hundreds of parents. So, oh my God, I'm obsessed. But okay, we're gonna shift now to talk about capacity. And I'm gonna pass it to Maria and Sarah. So just letting y'all know. To have capacity to sustain this work over time, you need internal organizational support structures, but sometimes the structure of government or nonprofits can be a barrier that prevents progress. What helped support your capacity, and what did you need to build up to be successful? And also, if there were any internal barriers you all had to navigate, feel free to share that here.
I can go ahead and start. I think for me, it was really about having supportive leadership. And I think recently in the past year, we just had a kind of change in leadership. We got a brand new assistant director of community health, and she's just wonderful and so supportive and very supportive of the parent and the parent works. And she's always, kind of looking at different ways in which we can incorporate the parents into not only health department initiatives, but just into the work that, that we all do. So it's really amazing. And she really advocates for, so for example, we're getting a new building in Elgin. And I think one of the ideas for us was to offer the parents a space to have at the health department. And so right now she's in the process of, advocating for us to be able to offer that space to the parents, because it's not just, it doesn't just go through her. Unfortunately, we have, the county board and other barriers that we have to get through before, it's a definite yes. So there are definitely a lot of layers. And as far as, expanding our work, I think it was also direct support from leadership. So I think I got the family run organization sent to me like 3 times. Like, Maria, you should apply for this. You would be great to continue the work, from both our executive director and our assistant director of community health. And, so then I had to have a conversation with parents and see if they would be interested in this, if this is something, that they thought would be beneficial to the community. And after that, it was just about sitting down and writing for it. And just giving it the time and space, because I myself and the person that worked with me, Clarissa, she's no longer with us, but we worked very hard on that proposal. So again, it was just about sitting down and, believing that our work and the parent work can continue.
And that's a good question, based on Sylvia's and Liliana's feedback about how they're growing and their leadership and the lack of capacity that COFI has internally for like hiring organizers, especially bilingual organizers. I think it's something that we are struggling a lot. And Sylvia said, well, Sarah couldn't make it with all the parents and a lot of parents in Elgin and Aurora. This model is very powerful and very attractive to parents, and we really need people that stays like a lot of time in communities, and a lot of times that's not possible. So we have people that comes and feel like organizing is just coming and empowering parents, or it's only training parents and not really working with them through the process of organizing and connecting them to different areas in the community. And one of the things that COFI has realized through the years is that we need to create organizers. So we're doing like this kind of like a pilot program right now. We started like 2 or 3 years ago, creating opportunities for parents to become team builders. And team builders are parents that are working in their own communities, connecting with parents, having one-on-ones, like practicing the tools that they're learning through the process of being an organizer, calling people, supporting with logistics through meetings, and also training them on how to be a trainers. I think Liliana mentioned that I'm also a trainer for COFI because she has been trained on the model, as well as Sylvia. So they both are on that stage where they have been trained on the become trainers for the COFI model, and they have been doing an amazing job. Liliana is supporting a new community where she started from the bottom, like doing outreach for parents, creating teams, bringing all the resources they need, creating the flyer, and finding a place to have the training, like all the steps that it takes to creating a group or doing outreach in the community and new communities. We always say that good organizers are going to be able to organize everywhere. A lot of times parents feel uncomfortable going through other communities because they're new, because they don't know the place, because they're afraid of, like, I don't know, no one there. But then when they started, they feel like, oh, I'm learning a lot. And that's something that Liliana is doing right now in a new community in Rockford. And she's so amazed in that way of like growing a space for growing under leadership now as an organizer. That's the challenge and that's the opportunity for her. But there are also other parents that have been doing amazing job in the whole state. We have 9 different communities, 4 in Chicago and 5 out of Chicago. And we have a team builder in each one of them and like with different levels of becoming organizers. There's a lot of potential for the parents, and we believe that definitely they can do this. There is challenges, also like technology, like not being able to submit reports, like all the admin work. It's something they're still struggling with, most of the parents, but they're ready and eager to be outside in the community. They know the model, they know the importance of creating surveys and have community forums and bring people together and advocate for each other, and not only on the mental health issue, but all the campaigns that we work with, and also connecting with their own school districts, administrators, coming to the board meetings and letting them know like what's they're there to support what the changes and everything that they want to do for the families. So I think that's one of the things that COFI has been doing to really expand the capacity for organizing and training parents. And we have like parents that they said, I don't like to be an organizer, I like to be a trainer. Or parents are saying, I don't like to be a trainer, I just like to be like coming to conferences and talk to legislators. That's my strength. Let me do that. So based on what they like to do, we really open the door for them to keep growing in that area and that opportunity. I don't know, Emily, do you want to share a little bit, probably governing council, executive committee opportunity for them as well?
Yeah, within our Power Pack, which stands for Parents Organized to Win, Educate, and Renew Policy Action Council, which is the parent organization that COFI supports. It's an independent parent organization that has a very structured governing council. And so they have representation, elected representation, 2 delegates from each of the communities that COFI supports, as well as 2 co-chairs for each of the 4 different campaigns that we work on at a statewide level. And because Power Pack is really committed to building Black and Brown solidarity, all of the co-chairs represent cultural diversity. So we have one co-chair that is usually a Latina and one that is an African American, to represent that we are organizing with both communities and that it's stronger to be organizing together. And those 24 leaders come together to discuss strategic planning on our statewide level, creating strategic moves in our different policy campaigns, and building their leadership as well, and getting to know on a deeper level other leaders across geography, having the opportunity for parents from Kane County to be going to Chicago parents to be going out to Kane County and seeing like how do things look similar and also different across community, and where are the ways that we're able to organize where we see that some of the issues that I'm experiencing in my community aren't just happening in my community. And having those one-on-ones and those conversations with folks from other communities helps parents realize that this is more of a systemic issue. If it's something that's happening in communities as different as Evanston and East St. Louis and Chicago and Aurora and Elgin, that it's something that is much more systemic and that we need to organize together to overcome.
Thank you all for those responses. Sarah said the way that we build capacity for organizing is to build more organizers, and I have not stopped thinking about that since you said that. Okay, we're gonna pivot and start talking about political landscape. Let's talk about the external dynamics in your political landscape. Since we don't know the players, there's no need to name names, but tell us about how you have navigated the dynamics with allies and opponents over time. Again, Sarah and Emily, if y'all want to kick us off with that.
Okay. Yeah, so I think within the local political landscape, I think in the last years, there's been a lot of growth of legislators, local state representatives, and state senators that are very supportive of the work that Power Pack parents are organizing for. And I think that also is a credit to the work of the parents of building those relationships and close relationships and being in very close communication with those legislators about what needs communities have. I know Liliana, Silvia, and other parents are often participating in one of the senators. She has monthly mental health policy committees where she is convening community members to discuss issues and thinking about how she can support legislation. And so there's a very close feedback loop on that. But there's also, I think the political realities of Kane County is that I think in the last 20 years, the demographics have changed a lot. Now it's a community with that has a very strong Latino population, strong folks organizing, but there's still a lot of folks that are, white communities that are more conservative. And so there's sometimes those political realities with legislators that maybe don't go quite as far as they could in supporting some of our priorities because they feel like they're caught between a rock and a hard place. And so I know that there's been other conversations that we've had with legislators that maybe aren't quite as out front in supporting things that maybe would say, in an ideal world, we would support this, but I can't. And so we have sometimes those more difficult conversations and trying to continue to push for the priorities that we have. While, there's not always support from everyone, right? So we have some strong champions, some champions that are, kind of in the middle. And then there's, I know also when we've gone to Springfield, some of our parents have also met with Republicans. And that is also something that that folks have to navigate at times. And so that's like a dynamic that I think we've dealt with on the statewide kind of legislative level. And then I think also within the kind of more hyper local as well.
Thank you, Emily. And I think one of the great opportunities that parents have in the local area is when they completed the surveys and they have the community forum, we really encourage them to invite people of power and to create a network that who is going to be supporting you with this vision or with this goal. And a lot of the people of power is coming through the table. And then we ask them like, how we're going to invite them and let's connect to them. Let's build a relationship. We always talking about the importance of build a strong relationship with people so we can create change. Everything that COFI does is through relationships. So parents get like very connected to legislators like locally, and they have like one-on-one meetings when the legislator comes and they can talk about their issues and the projects that they have. And it has been like really good meetings where the legislator is crying with the parents on the same issues and like getting connected heart to heart. But also there are other times when they're like, okay, so what is this for? Have you talked to this person? Have you talked to that person? And they're not really like clearly committed to support the parents on the issues that they're presenting. So we have had different experiences with different legislators, but also just the opportunity for them to really engage and to know who is who in the local area, who is representing them at the state level, who is at the federal level. Like I think educating parents also in this area is very, very important. And I'm just going to say that parents through the years, and now I'm talking about 10 years, even myself, like trying to really connect with who is representing people in the community. And this Friday, actually, the Parents or Coffee was recognized. It was the only community organizing, or the only organization that was recognized in the whole state for doing the work that they're doing in the community, especially through the Parent Power Center in Aurora. And we were invited to the Illinois Latino legislators, and it was like 17 legislators that were presenting, and it was just like an aha moment for all of us to see like how many Latinos are now in the power that we can count on, and that they know that this is a need. And I'm gonna let Liliana share a little bit about that experience, because I know that she has been like very connect not only on the local area but also the state, and also she has been in Washington D.C. talking to a lot of people and different issues.
Yes, Sarah. Thank you. And just to piggyback a little bit of what Emily was saying, parent attending those mental health advisory committees, uh, promoted especially for one of our biggest champions, a senator. And I was appointed as the co-chair for the mental health officially, because they want to engage more with the parents. So what I'm doing is, okay, they want to know more about the parents, so I bring to the parents like, okay, what do we need, what do we want to see on happening on those committees? And I will be like the relationship, like in between, like bring the feedback from the parents, and invited the parents to speak, what else do we need. Me being in that co-chair position is not only because it's about me, it's about all the parents. And I'm very proud to be in that position, because now, they can be seen and heard more parents. And that nomination that we have at first, it was just kind of like, oh, we see maybe many organizations are going to be recognized for the work that they've been doing. But the surprise was that no, we were the only one recognized at the state level, like Sarah was mentioning. And they specifically say, because the work that we're doing, supporting other parents, and it's a lot of that, it's new to legislators. It's like, how is that possible? It's like, just as parents, give us a chance and the platform to prove that, yes, parents with a proper support, we can do a lot of things. And it's just, like kind of changing the culture, how parents were used to be seen before, like the parents like coming to the meetings and just be asked, please, could you give me 5 minutes? And now coming, like inviting, could you come to our meetings? Like, I'm not going only to your meetings, but I need you to come to our table where the parents are. And that relationship building, it's been very, very, uh, how could I say, it been prosperous, because we've seen it's working. I've been invited also to Washington to a national level, where we have coffee parents are part of a bigger network, which is called UPLAN. It's United Parents Leader Action Network, where we have partners at the national level. And yes, sometimes not everything is given so easy. I have talked to congressmen, and sometimes their position is not very supportive, but guess what? I will meet you at your backyard, because everything that I brought to you to Washington, you have to see with your own eyes in your community. So we have time to follow up in their communities when they come here, and we have come up with meetings, just following the conversation that we have in Washington, but being able not to be only a few parents, but inviting more parents that they present. This is your community. So we're asking the support, because we believe that you can be our voice in Washington. So it's kind of like seeing the reactions, they don't expect this from parents. They don't expect to, and in the culture. The last congressman that we were meeting in Zoom, he didn't know that we have translation. He didn't even know, his office didn't know how that was working. And it's like, yes, because we are a diversity organization. So we don't have only English speakers, but we have Spanish speakers, and we give them the space when we have the supports for them. So he was like, I didn't know about that. So we kind of like need to educate our own legislators about how to hear their population, how to hear parents. It's not only in through your own language. If you need to provide assistance to listen, but you have to be intentional when you really want to listen. And we pointed out like when you want to listen. So he was kind of like, okay, I'm listening, and I'm very proud. I didn't know anything about translation, providing translation, simultaneous translation. So it's like he was seeing the way he was coming at first in the meeting and the way that he left the meeting, we could see it was different. Now, I'm pretty sure the way he will see parents from now on will be totally different. He's not gonna just promise and not deliver, because now we will come and ask the what's happening, why you haven't do what you were supposed to do. And that is something that parents will learn, make people accountable for their words. Not only, we are just like, because you're giving me a toy for my kid. It's not about that anymore. It's about making people, especially stakeholders, making them accountable for their words and their actions. If they're doing, we celebrate it with them. If they're not doing, we'll have a follow-up meeting with them.
Thank you for all of that. We're pivoting once again. This question is going to be for Liliana and Maria, and then we'll open it up as well. So the first half, we want to talk about analysis. So through this process of working, how has your analysis and understanding of the situation evolved, and how has it changed or sharpened over time? And then also for the whole group, if there's a story that hasn't been shared already around obstacles or challenges that has surfaced through your work together, can we share that and talk a little bit about how it was navigated? So like part A, part B questions.
Maria, if you want to lead first, and then I jump in.
Yeah, I think my understanding of, our situation has evolved in the way that I think, something that Emily had mentioned earlier was, a lot of the racism and anti-immigrant sentiment in our county, I think has really grown, especially now with our political climate really, really changing in the past couple months, and then also in the upcoming year. So that's been really difficult for myself to witness, not only as a Latina woman, but also a person who works with a lot of people with like mixed statuses and everything. So that's been really, really difficult to kind of witness. So I think with that, we did kind of come into a shared understanding of what some of the root causes and harms were. And I think with that, I can go ahead and pass it to Liliana, and she can explain a little bit more.
Yes, and it's again everything about surveying the communities, right? That's how we find out. We just make up those answers or those numbers, and we have find on those surveys that we did, lack of transportation. A lot of the families that they need the resources, they need the services, they don't have access to reliable transportation. They don't have access to a car. They don't have a car. And it's hard for them. They need the services, but it's hard because they cannot come, they cannot attend. And one of those issues we're trying to address, asking those agencies, is like how we can support them. At the Parent Power Center, if I can explain, because I've seen it, sometimes the same people that we are facilitating those support groups for them, we are the ones that have to support with the transportation. But sometimes, we already doing so much, and it's harder because I hate to be on time. I hate to set up the tables. I hate to arrange, childcare, and I still hate to drive and pick these families. It's a lot of on us. And we come to the health department with this issue, and we actually brought it to different stakeholders. It's like how we can find a solution, because we believe it's not this, we've only seen it with our parent power center, but have you seen that your families are not coming to your to their appointments? Have you wondered why? Have you asked them why? And if this is the same issue, is because of transportation, how you are changing that? And we start with a bigger communication about that. Like, maybe, as parents, I don't have the relationships that your agencies has, but maybe if we can connect with your relationships and your connections, maybe, we can help our families also, because a lot of those agencies, they can bill Medicaid, right, for the transportation. But for the parent power center, we don't work with Medicaid to bill for transportation. But not only that, we serve a lot of the families that they don't even have any Medicaid, any health insurance. So who we're gonna bill? It's no one. And they're coming to us because that's the only support that they can have. So this is becoming a big issue for us, because we don't want to send the family, sorry, I cannot pick you up anymore. It's a lot on me. I don't have the capacity. I don't have the time. I don't want to say that to the families, but we are bringing it to our other partners to see how all working together we can find in a solution to at least address this. And that I've seen is one of the biggest challenges that we are facing now, and we are trying to find a solution. But at the same time, it's very hopeful, because what we started in the Parent Power Center with the support of some legislators, it become like the pilot, the first of the at the statewide, the first pilot, and it seems like people is noticing, us being recognized and that ceremony that is statewide for the whole Latino caucus, and be recognized for them, it means we are the first one, but we cannot be the only one. So we want to replicate what we started in Aurora, and with the grant that we received, we were granted. We want to start now a different location in Elgin. Now it's not only one pilot, but now is the second one. And with this, we can deliver results. How many families we are serving, and those families, these services that they're getting, the peer-to-peer support, are the only thing that they have closest to a therapy, closest to a counseling therapy, because they're not available to get it so far. Because especially when they don't speak the language, like if a waiting list is getting better to 1 month, once you say you need it in Spanish, it goes back again to 6-8 months. And families, but I heard it was saying that you're doing better. Now your waiting list is only to 1 month. Yes, but when you need it in Spanish or in a different language, we don't have the capacity. And I was sharing with Sarah, I was especially in that committee that I was with the mental health committee. I learned from one of the agencies that was there. They say, offering services to one family, we charge 130, they bill to Medicaid 130, but the family doesn't speak English, so they need to provide interpretation services. When they hire someone to come with interpretation, it's like they charge $200, and we are billed for 130, so losing money. And as a parent, if I didn't know that, still be, like questioning them, why you don't have enough services in Spanish. But now that I learned that they actually are losing money, and they're still doing it because they want to help, for me, they change the story. It's like now, It's not local. It's not with the agencies. Now we need to bring it to the state level. The state needs to, pay for those services. Not the agencies has to suffer economically, because then they will have to, they don't have the financially, they will be impacted. But now finding this information is now, I already said to Sarah, we need to do something. We need to mobilize and bring it to the state level, because now we need to change policies there. It's not on the parents suffering for not having the resources that they need, but not blaming the agencies, because the agencies, some agencies, they still decide to help us support, but some other agencies, they just say, I'm sorry, I don't have the capacity, I cannot. Because they say sometimes we get grants, but the grants that we use, if we're spending that money to just for these services, we are losing money and we're losing the grants. If we don't have any more money from the grant, then we have to say we are not taking any Spanish speaker, because we don't have the capacity now or the resources also. So again, everything has to be organized and bring it to a different level. But so far, replicating what we started, we'll see a second one, and hopefully next meeting that we may have with you guys, we can have every city will have their own parent power center offering peer-to-peer supports.
And that would be really, really amazing. But I think I wanted to speak a little bit more about one of the points that Liliana was touching on with the transportation. I know the Kane County Health Department also noticed that a huge need in transportation for people who are, unable to get to their appointments, to get in, or unable to get to mental health support, medical support, any of support that might be. I know we offered it was a notice of funding for, I think, about $100,000, and we didn't have anyone apply for it. And even, reaching out to personally to these organizations to say, hey, this funding is available, would you be interested? It was really hard to get anyone to kind of respond back. So it's kind of hard, but it's also speaking to the lack of capacity at these different, organizations that provide transportation, because they're also very, strapped for people who can do the work.
Thank you both. Thank you all for adding that to the conversation. We are moving towards our wrap up. And again, these are questions for the whole group. So thinking about all the work you've done together, what are some of the biggest successes you're most proud of? And what lessons have you learned to share with others who want to do this too?
I think for me, I could say that the biggest successes for the parents is definitely growing on their leadership and have the opportunity to develop strategies to communicate with people of power and to support each other, to building a team, to work together. I think that's the most amazing thing that I can see is as a biggest success, because I believe that when if COFI is running out of funds or doing something else, the parents are equipped to continue to do the work in their own communities, to make changes for themselves and their families and other families as well. So for me, I could say that, and also, of course, other opportunities to keep growing on this campaign and keep making changes and keep being recognized and keep being recognized as partners, not only as parents and organization, but also as partners on the work that we're doing for the well-being of all of us. And I'm just going to stay quiet and pass it to Liliana.
Oh, I feel I've been talking a lot. I don't know if Sylvia wants to add something. I'm gonna give her a few seconds to say. If not, then I can say. But personally, the lesson learned is that a parent can do a lot more when you have the right support. If I reflect in my life, what I was 10 years back without the training, the proper training, without knowing that I have a web support, and like that, honestly, I could tell you, I would be working in a factory, a chef of 12 hours, and complaining and being frustrated for not being able to do more, because I know I am a smart person, but without the right resources or the right support, you cannot do much. And with that, I could, like, just recognize what the coffee trainings has done in my life. It's been just, they have empowered me in such a way where I really believe if that I've been able to do. And I really believe, we can do more things, because now the parents are supporting other parents. And it's not coming, like, I don't have the time. It's just, I got you because I was you before 10 years back. And if I did it, and I here talking to legislators, and I here standing out for all the parents, I know you could do it. Because all the mothers, all the parents, we already are leaders, struggling each day. But when you know you're not alone, you have a big support behind you and next to you and around you. Parents, they feel more inclusive. Parents, they feel more empowered. And with that, it's just priceless. uh, with this, we've been changing the culture where we can tell them, I speak Spanish, and I'm sorry if you need to hear my voice or need to have my input on something, on some issues, you need to provide translation. So, before, like, parents will feel ashamed for not speaking English. But now we could say, if the meeting is going to be translated, yeah, of course, I can go and support you, with my feedback. And now parents, we can come and say those things, if you really want to hear from the parents, you need to invest on those parents, like, you need to provide us for childcare. You need to provide, the space where we feel safe and supported. And those three things, we are based and we learn. Now we are demanding, like, you will share the power. You will change your culture where you see the parents as partners. That means sharing the power. You are not up here and I'm up here. When you see me here and you hear from me, and the why you really want to listen to me. You care about me, or you need to check a box. Now, parents, we are kind of like, if you really need my invoice because you need to check a box, maybe I deserve a stipend, because I'm helping you just to check a box. And that box for you sometimes comes with grant, with money. And if you are only using me, at least value my time, and that need to come with a stipend. And parents before is like, oh my God, they asked me to go to the meeting. I feel so honored. But it's like, okay, now it's like, why is the purpose? What do you want to do this meeting? What do you need? Do you want to hear my voice, my acknowledgement, and my live expertise? Now it's different. And now you could see I can be talking all along because they have empowered me in such a way that now. But Sylvia, if you want to add something, but I felt, really the partnership we have with the Kane County, they did all those three keys. They've been sharing their power, they've been investing in parents, and they've been changing the culture, because all the meetings that we have with them, they had to provide interpretations. They've been translated.
Sí, gracias, Lili. Voy a añadir solamente un poquito. Pues sí, definitivamente todo ir caminando con COFI, haciendo alianzas con otras organizaciones y sobre todo haciendo esa unión con los padres. Nunca pensé que yo podría ser modelo para otros padres. Padres vienen y me preguntan, ¿cómo lo haces? Quiero hacer lo que tú haces y ellos saben que, pero tú no hablas inglés porque estás con los legisladores, pero tú no eres profesional porque estás haciendo con esto con los padres. Entonces les digo, vengan, hay orientaciones, hay certificaciones, como padres somos fuertes y podemos hacer cambios. No necesitamos un título, no necesitamos hablar 2, 3 idiomas para poder hacer nuestra voz que se escuche. Entonces, la unión y las alianzas hacen el poder y nosotros los padres tenemos que estar presentes. Gracias.
Thank you. Let's move into our closing. Maria, I'm gonna pass it to you. If you could speak a little bit about the grant for the parent-led orgs and also the plan to create space for the parents in this new building.
Yeah, so super exciting. At the end of October, we got the news that we received a family-run organization grant that we had applied for. So that's super exciting. And, you know, in our work with the parents and of course, just really continuing to work with them and help them grow. I think one of the plans that we have is to build a second Parent Power Center at our new Kane County Health Department building. So our new Kane County Health Department building will it's ours, but I believe we'll be moving in early next year, perhaps around January or maybe sometime in the springtime. But after that, hopefully we'll be able to, you know, open up to the parents to go ahead and have a space there and conduct their peer-to-peer support groups from our new location. So that would be really, really exciting for not only you know, the parents, but also for the Kane County Health Department to be more open to the community, because I think for years it's been a point, you know, that we're not very open to the community, especially in the Elgin location. So it's something that we'd love to change and, you know, change along with the parents.
Thank you, Maria. That's really, really exciting. And I think lastly, gonna kick it to Emily and Sarah to close us off, kind of regrounding us in what you all have shared around how COFI connects services with organizing. If y'all could just speak a little bit to that.
Yeah, so one of the things that I think our goal of doing a lot of this parent-to-parent work, as Liliana mentioned, it's a pilot, is to demonstrate that parent-to-parent mental health and healing works. And so as part of our organizing, that has been our goal, to have this be involved, recognized as part of the mental health system. We know that this is work that Black and Brown parents, especially moms, are doing already. They're doing it in their communities, and with some additional training, they're really able to take it to the next level. And so that's what we want to that's what we wanted to demonstrate. And I think with the receiving of the grant, it's showing that is starting to get some recognition, that the work that parents are already doing is a really essential part of the system. And so we provide services as part of our organizing strategy, to build like a base of evidence, to show like this can really work. This is really exciting. And it also helps us in our organizing because parents are then on the ground hearing in a way that they maybe would not be able to, like they just have extra people that they're able to hear from. Of what's working and what's not working. And so that's what we always are checking in with parents about, of what is working, what are people saying, what are people sharing? And that's something that, you know, we've been hearing now, as I think parents already knew that transportation was, you know, an issue, but I think because they've been doing the work with the Parent Power Center and parent cafes, that now it's like, oh, transportation is a really big issue. This is something that maybe we need to focus on, and maybe we need to reach a campaign about, and having more information about like what exactly with transportation do we need to focus on, getting more specific, because we have that feedback from lots of people that are trying to get access to services. And so it's also a strategy on our end to understand on like a nitty-gritty level what's working and what's not working in the system. And so I think that's also very important, that parents that are providing peer-to-peer mental health services are also really deeply engaged as leaders, as part of an organizing model. And so I think that is also like a really important part of the model that we share as it grows. And if other people are interested in doing this, I think that is like the key piece, is that they, even as they move into support work, they're still really grounded in organizing and grounded in a base where they're working with other parents, some of whom are also providing services and some of whom are not, but to be continuing to work on the outside to be organizing for those systems change that they see.
Thank you, Emily. Sarah, anything you would like to add? Or would you like to close us off?
No, I think we already shared everything. Yeah, a lot of opportunities and challenges, but I think that's the organizing way, right? That's what we're here to deal with that, and to look for better strategies, and to really, like Lily said, educate people of power to unify mental health providers with families and legislators, and just support all the work that they're doing, but also letting them know that parents are important to be at the table.